Hi, my name is Kel and I'm a therapist and educator with a special interest in eating disorders. Come on in, take a seat, and if you haven't already, don't forget to subscribe for bite-sized content across the mental health and eating disorder spectrum. In today's video, I wanted to talk a little about supporting parents and carers of those affected by eating disorders. I recently had the opportunity to both attend and speak at Beets Frontline conference. This is an annual conference for parents and carers of those affected by eating disorders, offering information, signposting and education on the topic. This year there was a wealth of information with a collection of Beet ambassadors talking about their lived experience and their journey towards eating disorder recovery, as well as professionals speaking on topics such as NG tube feeding, getting the most out of dietetic appointments, and supporting a loved one in their transition of care as they go to university. So there really is a lot to learn. But there was something in particular that I took away from the conference, and that was unfortunately exactly how much pain and distress is experienced by those supporting a loved one with an eating disorder. I think as an individual one-to-one therapist, I'm sometimes guilty of overlooking how much eating disorders might affect the entire family because I spend the predominance of my time just working with the individual affected by eating disorders. I'm not a family therapist and I'm not a couples therapist. And so in today's video, I wanted to just touch a little on how those different people potentially involved in the person with an eating disorder's life might be affected by this experience, and some things that we might like to think about in relation to that. So let's start with thinking about parents of those affected by an eating disorder. Parents often report really strong feelings of guilt and responsibility when it comes to supporting their child, irrespective of whether it's a child, adolescent or adult affected by eating disorders. And those guilt feelings can come from a sense of, is this my fault? Am I responsible for this? Should I have done something earlier, seen the signs sooner, got help sooner? I don't know how to do this. How do I do this better? What if I can't save my child who is struggling so much? And we must keep in mind that these parents are potentially watching their child struggling with what could be a life-limiting or life-taking condition. Eating disorders have the highest mortality rate of all mental health illnesses, as you probably have heard me say before. And caring for somebody in this situation can also have a big impact on the parent's mental health as well. That could be that they go on to develop depression, anxiety, or even symptoms that would correlate with post-traumatic stress disorder. And it makes this really important that we signpost these individuals to care and support for their own needs if possible. And that is especially true if they're primarily the person supporting the individual affected by the eating disorder. It's important for us to keep in mind that we probably only see, assuming that most of you are talking therapists, 1 hour of the individual's life, whereas the parents and carers may very well be there 24/7 for this person. Moving on from the parents a little, let's think about siblings. I feel that siblings' thoughts that I've heard expressed around supporting their sibling with an eating disorder are actually quite complex, and they can be a tie of feelings around jealousy and guilt. So the jealousy might come from feelings such as, my sibling is all of a sudden taking up such a lot of our parents' time. Where is the time for me? Where is the care for me? And where is the support for me? And that's absolutely not to say that the parents aren't attempting to give that equal care and support. And I guess that's where the guilt comes into it. The sibling is often able to recognise that their unwell sibling needs this extra care and support right now, and therefore they can additionally struggle with feeling guilty about feeling that sense of jealousy. If this is a child or adolescent that we're talking about, that sibling might find themselves struggling with a behaviour outside of the family home as well. It might impact upon their attainment and behaviour at school or in social relationships. It might be that that is in terms of them struggling to come to terms with what their sibling is experiencing, struggling to come to terms with the changes to the family dynamics, or it could also be that they start to take on some responsibilities of caring for their sibling with an eating disorder, and that starts to eat into, pun partly intended, their lives as well. So it can equally have a massive impact on the siblings. The other relationship I particularly wanted to highlight was the spouse relationship, partner relationships, because as I've highlighted in previous videos, we often focus on children and young people when we think about eating disorders. But eating disorders also affect adults, and those adults may very well be in relationships. They could be married and they may even have children, and in this instance, the impact upon the spouse can be huge. The main area of topic that I have heard and had conversation about of late in relation to spousal relationships is how it impacts the power dynamics, the power differentials in the relationship. So in healthy relationships, ideally there is some reasonable sense of power balance between both parties in a relationship. There is some give and there is some take. But when an eating disorder is unintentionally the third wheel in a relationship, it can become that the well partner ends up sacrificing a lot in support of their unwell partner struggling with an eating disorder. It may be that it affects their ability to attend work, or if they are able to continue to work, that they're preoccupied because they're worrying about their spouse. Maybe there is need to respond around food differently, take their loved one to appointments, and there could be impact on childcare if there's children in the situation as well. And that's absolutely not to say that somebody struggling with an eating disorder would be particularly unable to care for their children, but that the other spouse might be left handling certain things, such as explaining what it is that the other parent is struggling with to the children in an age-appropriate way. So there really is a lot of potentially complex things to consider in terms of how the eating disorder affects the entire family. And there is also one last point, which I guess is in relation to the more extended family. When there is an eating disorder in the family, those family celebrations, and I'm sort of thinking as we come up to Christmas in particular, might be affected, and something to consider in relation to the individual affected by an eating disorder. And this might be topic of conversation around factors such as who we tell in the extended family and what we tell, how we explain this to them, and what support we do or don't want them to give. We have to bear in mind in all of these instances that any or none of these people might have any solid information or understanding of eating disorders prior to their loved one struggling with it. And they might very well have their own internal biases, fat phobia, they may be sucked into diet culture and use unhelpful language themselves, and there really is a potential steep learning curve and lots of triggers and difficult communications that happen when an eating disorder is in the middle of a family. None of this is anybody's fault, and it's not in any circumstances helpful to blame anyone, especially if the relationships are attempting to be supportive, and even if the relationships aren't being supportive, that might be because the parents and carers, or parents, family members, I guess we'd less be talking about carers, don't know how to best support and just feel lost in this whole thing. When it comes to your practice, some things you might want to think about is exactly how you want to or are able to work with parents and carers affected by eating disorders. Are you a family therapist? Are you a couples therapist? Are you somebody that's interested in working specifically with parents and carers of those affected by eating disorders, as well as or instead of the individual living with an eating disorder? Something that I think is relevant to me is that I'm really clear, as much as is possible, on my website in an initial communication about what it is that I do and do not offer. So as I said before, I'm an individual one-to-one therapist, and for the most part, I am not engaging in any support or sessions which involve family or couple therapy in any way. I don't feel that I'm qualified to do that. However, it is often parents or spouses that reach out initially seeking support for their loved one affected by an eating disorder. So I'm aware that that might very well be who reads the information on my website, and accordingly I do indicate there that it is only individual therapy that I offer. And then if it's a spouse or a parent or a sibling or a friend that gets in touch, I'm always mindful in my communication to direct them to some support and some signposting where they themselves might also access some support if they feel that they want to, are able to, or that it would be helpful to them. I will include in the description box to this video some signposting that you might want to share, which would include some of Beet the Eating Disorder Charity's services. Other things to think about here are how and if, as an individual therapist, you do communicate with, respond to parents and carers. So for me, what I have found is that although I am a one-to-one therapist and I'm explicitly saying that it's up to the individual and it's the individual I'll be working with, I have found that in many first sessions, particularly if parents or spouses are part of the equation, that those people want to come to a first session. I find that for me, the best way to handle that is to make sure that I have conversation with the individual who's actually going to be my client to see if they would like that person to attend. And often they do want that person to attend. They want that person to have their questions answered about how I work or what therapy is, or maybe some additional signposting, or maybe they just want their hand held as they come to therapy for the first time and are feeling pretty overwhelmed. So in those instances, I might encourage the parent, carer, spouse to attend a proportion of the first session. And at that point, I will make it clear again, so potentially for a third time, that I am a one-to-one therapist and what their options are if that doesn't work for them, if that isn't the type of support that they're looking for, and some additional signposting again, and perhaps even printing out information that I might have mentioned in email correspondence before. But increasingly what I'm aware of is that different people affected by eating disorders might want those interactions to happen differently. And I've learned over time that it's necessary to explicitly have those conversations with the client on an ongoing basis. So particularly some young people that I've worked with might want me on occasion to have a conversation with the parent, and I have had to think about how I am comfortable in doing that. How do I have that conversation with my client to ensure that they're getting their need met? Do I feel comfortable with having that conversation? What would that mean? What are the boundaries to it? But also bearing in mind that our interest should be what is in the best interest of the person that we're working with. And I know that sometimes we as therapists take home blanket messages, such as if you're a one-to-one therapist, you should not communicate with parents and carers, for example. But that isn't always what my clients want. And I think as long as it's contracted and clear and within ethical boundaries, that there is some scope for discussion and debate about how that could work. And these are some things that you might want to consider thinking about. Even if you don't want to work with parents and carers and you simply want to offer some signposting, it's also worth considering who and where you signpost to. Are there other therapists that you feel it would be good to directly signpost to? Are you comfortable directing to Beets Help Finder, where eating disorder professionals are listed? Or perhaps you know a couple of therapists who might be good to signpost to. Maybe you just want to give some basic leaflets from Beet. You can contact Beet, the Eating Disorder Charity, and ask for those, and they will send some out to you that you can pass on to clients in the future. Or maybe you even don't feel comfortable with giving direct signposting and you'd rather say it might be good to access some care and support for yourselves, but I'm not able to give you explicit signposting, and be really clear about where it is that your boundaries are in relation to that, but also being clear that it is helpful, positive, and arguably necessary for parents and carers of those affected by eating disorders to also access support, because ultimately that is in your client's best interest. If their parents and carers are well supported, chances are they will be able to best support your client as well. And so we really are thinking about the whole family, potentially, even in instances when we never meet them, see them, or communicate with them. And you may even want to give that signposting to the client to pass on to those people in those instances as well. There's such a lot here to think about, but trying to keep this bite-sized content, I'm going to leave this with you. I would love to hear any questions or any feedback about this as an area in the comments section below. Are there any things I haven't mentioned in this video that you've thought about? And maybe if I haven't thought about it, something I need to take some time to think about. Don't forget to leave that in the comments section below too. Until next time, be kind, be curious, be yourself.